How it can protect your family. Tonight at 4 and 6, only on Local 3 News.
Local 3 School Patrol, covering the classrooms in your community.
Okay, I want to kind of let you know before we begin our next conversation, it's a bit of an adult topic, so if you have children in the room, maybe even some middle schoolers or something, you might want to just be aware that our topic this morning, Dr. Steve Miller with the Hamilton County Health Department, is a real concern for really everybody watching. Am I right, Dr. Miller? Because
You are
you're
correct.
seeing a rise of STIs
We are.
nationwide,
And
here in Chattanooga too.
what affects our nation is affecting our county as well. We're seeing a tremendous rise in sexually transmitted infections. And that's why it's the month for that. It's Awareness Month for that.
So let me pause a second, because I think that this would be fair to say. There are probably a lot of people watching right now who are thinking, that doesn't apply to me because I'm married or I'm this or I'm that. But the truth is, if you have somebody, anybody you know, who isn't walking your path, it could happen to them.
Sure. And we've seen latent infections in people that have been married for 10 years, 20 years, from a partner that may have been with 20 or 30 years prior. It's important that people get out and get tested for this. The rise in syphilis alone has increased to the point where what we see in a week is what we used to see in 3 or 4 months 10 years ago.
So you just said, I think I heard you say, that you could have had a partner 20 years ago and only now would symptoms show up? Is that what you're
We
saying?
see cases of that on a weekly basis. That's
Really?
correct.
Is that how it's always been? Or is that something new?
No, I've seen that for years, but unfortunately we're just seeing it much more frequently now.
The concern too, I guess where my mind was going when you were talking about the widespread concern of this, is that you're seeing then babies born.
So with understandably the rise of the sexually transmitted infections, especially syphilis, we're seeing a number of children being born with this. A child that is infected in utero with syphilis has about a 50% mortality rate. If the child is born, the chances of them having different kinds of congenital abnormalities is tremendous, and that can be hearing, vision loss, developmental delays, the list goes on.
So with testing, both men and women should come in to get tested, is that correct?
That's correct. And one thing to be aware is that we're seeing these in our younger ages, our 15 to 24-year-olds. So we need not only just people that are in their 30s and 40s, maybe they're engaging in a new relationship or a new marriage or something of that nature, but also the younger individuals need to not feel that these PrEP therapies that they hear about or they partake in are sufficient enough. They need to be tested on a regular basis. If you are not in a monogamous relationship, we recommend multiple testing a year.
But even if you are in a monogamous relationship, you don't have any way of knowing that's your partner.
It's good to get a baseline test for not only you, but your partner. As you embark on a new relationship together, it needs to be done in a safe manner.
Is there, you mentioned the 15 to 24-year-olds, that whole, the nature of being that age anyway, is that you think that your life isn't going to touch you. And then nowadays with social media and Google right there, they can look up anything. So they have false, do they have a false idea?
It's a false sense of security. You know, you think you're invulnerable, but then as you get older, you realize you certainly are not. And the mistakes we make when we're young will follow us.
Is it curable or is it only treatable?
Many infections are curable, most are controllable, but we can't do anything with it if you don't know that you have it. So get tested.
You mentioned the mortality rate in a baby born with it. If you are an adult, essentially, with syphilis, for example, does that impact your own lifespan?
It can. Not only do you get the initial sore and then the subsequent rash, but then after that, a disease like syphilis will lay dormant for decades. And then when it finally does come to the surface and you're experiencing neurological problems, Alzheimer's type of symptoms, it's too late at that point. It's done its damage.
I know that I'm going to step my toe into waters that are tricky, so you can just slap my hand if you want to, but is it a fine line we walk between wanting people to be able to get the help they need versus kind of having it be an anything goes, let's don't put any stigma on anything mentality. Do you see where I'm trying to go?
I do. You know, we enjoy our personal freedoms, but at the same time, we have to exercise caution in the actions that we do and what we engage in. And we need to be mindful not just of ourselves, but of who we affect by our actions as well. So, you know, not only have respect for yourself, but also the partners that you're with. Get tested frequently if necessary, because it's vitally importantly not only to you but to the community around you.
Okay, in terms of the testing, how do they go about getting it? Can they just show up? Do they make an appointment?
We have several walk-in appointments a day at all of our health department locations, but we prefer that you call for an appointment as well.
If you are a minor, is there a different way of getting that appointment? Do you have to have a parental consent?
No, not for treatment, not for testing and treatment of that. No,
Okay, is there a fee associated with it?
Sometimes there can be a nominal fee, especially if you're out of state, but that fee can be waived as well.
And then if people are concerned about, if they might say, well, can't afford certain things, to try to prevent and be safe, you provide
in most
that?
cases, we provide the treatment on site. And if it is something that's more in depth, we'll say like HIV, we'll refer you to community partners that will be able to get you that affordable treatment as well.
And as in all things medical, it's private.
Every bit of this is private, of course. We guard all information. We don't discuss the cases with other family members, with loved ones, or anything of that nature, no. Very discreet.
I'm very glad that you came and shared. I had no idea the month was dedicated to it, but to realize that this is a problem across the country and that we're seeing it right here in our area, to have this resource available and not take advantage of it. You don't want to let that happen, do you?
No, you do not.
Thank you so much, Dr.
Thank you.
Miller.
Thank you for having me.
You can find out much more about how they can help you with this testing as well as any other health-related issue in your life at health.hamiltontn.org. Their phone number, if you do want to call to make that appointment, 209-8250.
Hello, I'm Chris Keith from Wedemark Keith. After a car wreck, things can get really tough. Let us help make that easier. We're more than lawyers. We're your support, guiding you through a potential nightmare. For us, it's more than a case, it's personal.
Hi, this is Christy and Jen from Mango's Decor.